I think it's a big concern, Yvonne. We have cases up probably about 55% across Europe, and that's a surprise because lots of countries felt like we move on the vaccination and we'll be past COVID, but there's actually multiple factors at play there. First, of course, is vaccination rates. They're varying quite a bit across countries, with some countries like Spain up at 80% and others much lower, like Russia, around 32%. But you have vaccine confidence concerns, and even bigger, you have logistical issues in terms of the rollout of the vaccination programs. And one of the biggest concerns, of course, is just recently this big syringe shortage and a possibility of as many as 5 billion syringes being short. But finally, you have also a general relaxing of public health and social measures in many countries across Europe, which is something that really needs to be addressed as we head into this winter month. More people are indoors, and more people will be coming in contact with the virus, even if they are vaccinated.
How similar or different will it be compared to last winter, when most Europeans were not vaccinated against COVID then?
Well, clearly the vaccine is protecting people against serious disease and death. That's been one of the chief consistent findings that we've had, even in the discussion around boosters. But the issue that we have this year that's a bit different, ironically, is that people mentally feel like we're beyond COVID. So they last year were very careful about public health and social measures. Many businesses shut down, restaurants, et cetera. This year, those are open, and there'll be a big resistance to going back to those types of lockdown measures. Now, I guess I should point out, as the person who used to lead infection prevention and control for WHO, all of these activities that I just mentioned can be done safely. This whole idea of what's essential and what's not. Many things can be essential and can be done safely if we practice basic public health measures, and we're used to them. And it involves mask wearing, it involves washing your hands, and it involves managing the number of people in any given open space.
So it's really no time to be complacent just yet. And to add to Europe's woes, as you've mentioned, there's a syringe shortage on its way. Tell us more about that. When is it likely to hit, and how severe will the shortage be?
Well, first off, Yvonne, I should compliment you and the world, because you were one of the first outlets to talk about syringe shortages with myself and a few others as early as last summer. And the global partners now who are working on global health, UNICEF and WHO, have come out finally and said, yes, it looks like we are in the midst of a major syringe shortage. And a piece we just published in the Washington Post yesterday says that that shortage is probably at least double what we are talking about now, at least 5 billion syringes short. And there are a few reasons behind that have to do with some of the magical thinking that we've had with this outbreak. First off, we've thought of syringes, PPE, and vaccines and the supply for developing countries as if it's magically insulated from what other countries, high-income countries, might need. And we saw that that's not true. Now we're all competing for those same syringes, and why we're going to be 5 billion syringes short. Secondly, there is this thinking that we plan and forecast what we would need for syringes back early last year, or in December 2020, and laid out a picture of the syringe market that said, well, it's relatively adequate. But we didn't update those numbers. And so all of a sudden, in a pandemic that changes every day, we were using old estimates. And we've now seen that we're going to be significantly short unless some concerted action is done in the next number of months.
So how soon do you think this problem can be overcome, and what impact will it have on the vaccination drive of many countries?
Well, obviously, being 5 billion syringes short is a lot of syringes, and it's different than the vaccine issue, where we will have more vaccines actually coming online in the next number of months, and many other producers who are working on this. The syringe market is a relatively constrained one, and it's difficult to ramp up production. In addition, we have constraints around the Pfizer vaccine uses a special syringe for its dosage of 0.3 milliliters. And we've had concerns about export constraints from different countries that are big producers on syringes. All of those mean that in terms of looking at how we solve this, it can't be business as usual. There'll have to be a big push for syringes, just like we had on vaccines. We haven't had it. And we'll have to look at new technologies. This is the opportunity COVID has presented to us in many other places, the opportunity to look at new technologies for syringes, things like single-dose pre-filled syringes and others that are out there.
Meanwhile, Dr. Kelly, Britain is the first country to approve the antiviral COVID drug Molnupiravir. How does it work, and will it be widely available?
This is one of those questions that we should learn from our just recent experience with the outbreak. If we're not careful, this drug can also follow the same path that some of the vaccines did, where massive purchases by countries that can afford it mean that places that are suffering from big outbreaks don't have it available. But this drug does allow for better management in hospital of very sick patients. Right now, there's a limited number of doses in the tens of millions that are being produced for this year, probably much more next year. But it's already looking like advance orders from high-income countries are going to occupy a significant portion of that. So we can only hope that we learn from some of these equity lessons for the drugs that are coming online, and there'll be more that will be coming, thankfully.
Indeed. Dr. Edward Kelly from Geneva, thanks for talking to us.
Thanks so much, Yvonne.